Welcome to this presentation about capacity building and training of professionals in social work and HIV/AIDS. We have with us Dr. Bernard D'Souza, who is a director of the Cell for AIDS Research and Action Training, which is located in Tata Institute of Social Sciences, Mumbai. Dr. Bernard, to begin with, can you tell us briefly about the Cell for AIDS Research and Action Training, which is established in the Tata Institute of Social Sciences, Mumbai?
Actually, when the HIV and AIDS epidemic was becoming visible in Bombay, and you would say also in the country, the need was felt for counseling training, and that's why that is when TISS had begun to respond and collaborated with the Directorate of Health Services to provide counseling training, because social workers were placed in hospitals and began to see people affected by HIV. And since then, in 1993, the Ford Foundation had given us a grant to set up a cell which would basically consolidate the work that was already taking place and also expand. So the objective of the cell is to basically conduct research, training, capacity building, and also undertake advocacy and do innovative interventions in the field of HIV and AIDS. So the cell is now almost 12 years old, and today a lot of our work is also at the international level. We had initially done research work with social workers in Bombay, basically to understand what were their training needs in relation to the HIV/AIDS epidemic. And from that and our other experiences, we began to develop curriculum in the field of HIV and AIDS. And TISS was also the apex center. I mean, the cell was the apex center for counseling training in the country as part of the National AIDS Control Program. Today we are doing a lot of training. We have a 10-week program actually on HIV/AIDS counseling and psychosocial interventions, which basically caters to professionals working in the field of HIV and AIDS, sexuality and reproductive health in India. And also we've been getting requests from Africa, South Asia, Southeast Asia, and so a significant proportion of the participants are also from these countries. Currently we are doing capacity building for all AWARD sponsored projects who are working on targeted interventions, care and support in the country. Most of their staff are social workers working in the field of HIV and AIDS in Maharashtra on different projects. So that is a USAID funded project, and we're also going to be collaborating with the UNDP, basically to build capacities of NGOs who are working on gender issues and development issues in Haryana, Uttar Pradesh and Punjab on HIV and AIDS.
Dr. Bernard, you spoke about various activities of this particular cell. In that you mentioned about research. Can you highlight about some details about the kind of research that you are doing in the area of HIV/AIDS training and prevention programs, the type of training that you are doing, and the kind of action that is taken as a result of this research work that your center is undertaking?
As an institute and as CARET, a number of research studies have taken place in the field, have been undertaken in the field of HIV and AIDS. One, there have been many situational assessments to understand risk, to understand governmental response, NGO responses to the epidemic. Then currently there is a study going on by two colleagues which is looking at child-headed households, because that is becoming a major reality in our country, especially in high prevalence states. There are many research studies. Two other studies which are also well known are on stigma and discrimination, and community and household responses, which another senior faculty member at TISS has undertaken. Then myself, I am personally engaged in a study on understanding sexual negotiation among serodiscordant HIV couples, and how does HIV impact their lives and their choices, and how are they able to negotiate safer sex behavior. So these have been some of the studies, and the purpose of these studies is, one is to inform interventions, to advocate for the groups that we are doing research on and with, and also to carry it into our curriculum, because a lot of this work does get integrated into our teaching, into our field work, into our the kind of extension work that we do in the field of HIV and AIDS. So it's not research for research's sake only, but to definitely to feed interventions, to feed policy, to advocate for the communities that we are working with.
Dr. Brunal, it is nice to hear about the various type of research work that you have undertaken, and I'm also keen to know about the kind of training program that you are providing, especially for capacity building of the professionally qualified social workers and other key players in the area of HIV/AIDS prevention in the state as well as across the country.
That's an important question. I'll start with the MA program first, because since we have a history of doing a lot of work in the field, both in terms of advocacy, research, interventions, this has naturally flowed into our teaching program at the institute. So take for example the Department of Medical and Psychiatric Social Work. We don't have a separate paper as such, but HIV is very consciously integrated in all the papers or all the courses that we teach in health, because it is a major health issue, it's a major development issue, it's a major human rights issue, and that is consciously linked to all our courses. Besides, that is in the Department of Medical and Psychiatric Social Work. In the department, there are other departments like Family and Child Welfare, who ask the CARET team, for example, or the Department of Medical and Psychiatric Social Work to organize special workshops for their students, because they are increasingly now beginning to see cases of HIV in their work, in the communities and families that they are intervening with. And so we have these requests coming in. Now, while our training is not specifically geared to social workers per se, the Cell for AIDS Research Action and Training, a lot of the people who come to the training are social work professionals also. So in that case, we are reaching out to them, though not very directly or very consciously, but a sizable number of people who come for our training programs. Now, the 10-week program that I spoke to you about is an advanced program on counseling and psychosocial interventions that has people from state AIDS control societies, from major NGOs, both national and international, and or maybe even research scholars. Now, many of them have a social work background. Then, since most of our work also is done with, the AIDS control societies, many of the national programs have social work training. So the training that we undertake for the national AIDS or for the state AIDS control programs then also is indirectly training that is also done to build capacities of social workers who are working in these programs. Then there are also specific requests by NGOs in the country to do tailor-made programs which we also address. So this is about our work.
Dr. Brunal, you spoke about kind of financial assistance and other assistance that you are getting from various quarters. We are keen to know about the linkage that you have with the government of Maharashtra as well as the government of India in terms of programs, in terms of financial assistance, in terms of your intervention in policy making as well as representation in various bodies.
Yeah, we definitely and consciously work with government as well as with non-governmental institutions. Now, in terms of government, we are a major presence in state aid society, the state aid societies in the state of Maharashtra, and also in NACO there is a presence, besides other bodies that may be, say, the governor's committee on HIV and AIDS for the state of Maharashtra. So we have been playing a very major role in policy making in both the state and at the national level, especially in the area of counseling and ethics and research. That has been the major areas of our contribution.
You spoke about help being given by donor agencies for various projects. Very often we hear about donor-driven agenda. Do you feel that the donors that are supporting your projects are also forcing you to follow some of their ideas and agenda?
I mean, that is a major issue in the field. Donor-driven not only donor-driven agenda, but also donors trying to influence, what kind of policies and stances one should engage in. For example, take if you're having, if a particular donor is funding programs on prostitution, then they also don't want you to take a particular stance, say on legalization of prostitution and things like that, which I think is something which one really has to actively work and work at and question. Fortunately, we as being a university which a major credible presence in the field are able to challenge these things, which a lot of small organizations may not necessarily be able to do. And so we negotiate strongly and hardly to be able to devise programs and implement it based on our understanding of the field, based on our interactions with the stakeholders in the field, and wouldn't want donor agencies to prescribe programs and strategies to us.
Well, Dr. Bernard, I am keen to know about the role of social workers, both the professionals as well as practitioners, social work teachers as well as practitioners in the area of HIV/AIDS education and prevention in this country.
Yeah, I think the social work profession has a very important role. When we're talking about social work, here I'm talking about both in terms of educators and practitioners in this field, because this is an epidemic which is primarily affecting those who are marginalized, and as social workers our primary commitment is towards those who are marginalized. So that brings us naturally into the HIV/AIDS epidemic. The principles of social work in terms of self-determination, in terms of social justice, in terms of the ethics and values that we hold dear, also makes it imperative for us to work in the epidemic, not only in terms of prevention and care and treatment. That is one aspect which is important, and which I think there has been to some extent some leadership from the social work profession, but also in terms of influencing policy and playing a major role in advocating for the rights of the people who are affected by this epidemic, and being able to look and also critically analyze factors at the macro level, the political economy of health, of development, which basically is creating conditions of vulnerability for people, and also how HIV and AIDS is affecting people who are marginalized. I mean, it affects everybody who is infected with the virus and affected by it, but those who are marginalized get even more further or share a greater deal of the burden of the epidemic. We also have a special commitment to groups who are anyway on the fringes of society, like women in sex work, men who have sex with men, or women in substance users, prisoners with HIV, because these are groups which are normally forgotten even in the course of HIV/AIDS work. I mean, we reach out to them more in terms of high-risk groups than as people who have rights and who also rightfully should be able to access services to protect themselves and the people in their lives.
Well, Dr. Bernard, it was nice having you with us for this interview. One last question or a kind of intervention which I would expect from you. Your message to the viewers, both the students of social work as well as other professionals, teachers and practitioners in this country.
I would like to give social work students and practitioners and educators is that social work has a very major role to play in the HIV/AIDS epidemic, not only in terms of service delivery to those who are affected, but also reaching out with comprehensive programs to those who are vulnerable to the epidemic, and most importantly in terms of advocating for the communities that we work with in terms of their rights. That's the kind of message that I would like to give.
Dr. Brunal, it was a nice time that we had last 15 minutes, and you spoke about the cell that is there in the Tata Institute of Social Sciences for capacity building, for research and training of professionals in the area of social work and HIV/AIDS. We look forward to having more such interactions in future. Thank you.
Thank you. It's a pleasure.